Washington University Shoulder and Elbow Fellowship has a 20-year track record of providing cutting-edge fellowship training. We have a very well-developed academic curriculum. We have 5 high-volume shoulder and elbow specialists, and we offer really state-of-the-art and cutting-edge research opportunities within shoulder and elbow.
The traditions of Washington University Shoulder and Elbow is really built on the shoulders of giants. So the fellowship was started by Dr. Ken Yamaguchi and Dr. Lisa Galitz joined shortly thereafter, and really built a strong foundation in not only clinical expertise and acumen, but academic prowess, and has really taught us a lot.
Our academic program is very special and unique because we have both well-balanced didactics and a high surgical volume. So we really give fellow candidates an unparalleled operative experience combined with excellent didactic training. In addition, we offer a independent operative experience at the VA at the attending level for the fellows, which they really enjoy. It allows them to gain their independence with their surgical skills.
The Shoulder and Elbow Fellowship at Washington University really stands out and is differentiated by both the breadth and depth of training across a variety of different attendings, but also the in-depth experience both technically as a surgeon, where they'll get a lot of hands-on experience, and our expectation is that they will be active participants in surgery and have, to some extent, a significant degree of autonomy throughout their fellowship, which I think is unique for this fellowship compared to others.
I think the trainees can be very comfortable in that they're going to have a comprehensive didactic academic program that covers all pathologies in the shoulder and the elbow, from the simple procedures to more complex things such as tendon transfers, revision arthroplasty, fusions, etc. So you can leave here feeling comfortable that you understand the fundamentals on all aspects of shoulder and elbow reconstruction. In addition, our faculty have very much been involved in research related to software program design, which is kind of the future of CT-guided software planning for shoulder arthroplasty, which is really a big part of our practice now.
We have a unique advantage here at Washington University with academic productivity in that we have a well-constructed and devised infrastructure for research. This is clearly, academic productivity is clearly a foundational mission here at Washington University, and we've been able to create an infrastructure that allows trainees, fellows, and residents included to really join in to the already moving train, so to speak, and jump in with ideas and have a great underlying foundation for both funding and executing and designing research in a way that's uniquely strong here at our institution compared to other institutions.